Okay.
All right. Okay, so this is a general overview of what our arthroscope looks like here. Here's a picture of Dr. McCain back in the 80s when we still looked through the arthroscope with our eyes. Now we attach a camera that then allows us to project the images onto screens in the OR. And the arthroscope itself and all of our surgical instruments are about the size of the shaft of a wooden Q-tip, is how Dr. McCain likes to describe it. So the first thing is that you'll be put to sleep. We place a breathing tube in through your nose. And then the second part of the exam is an exam under anesthesia. And so we're moving your mouth open and closed to assess your joints with you completely asleep. This is what the positioning looks like. So your head is turned all the way to one side, and we prep your face. And basically this is where the joint is. It's immediately in front of your tragal cartilage. And so there are no incisions with this procedure. We spin a sharp instrument into your joint, and that's how we enter. Ultimately, at the end of the procedure, that's closed with sutures that will dissolve on their own. And so this is a picture of what it looks like when we have that initial portal, and this is the portal where the camera will enter. Here's kind of a cartoon representation of what that looks like. And so then we can put in our camera and see inside the joint. Again, just showing you where we are working. It's called the superior joint space, so the small black space here. And this is a view of what it looks like when we enter your joint. And so this is, again, kind of a bird's eye view of the patient positioning. An assistant, myself, will have their hand inside of your mouth opening and closing you. And then you have the camera, which is closest to the ear. And in front of that, we have a second portal, which then allows us to put in our surgical instruments to do a synovial biopsy, to use the laser, different things during the procedure. And so then the whole point of arthroscopy is diagnosis. So what we're doing is we're going to what are called 7 points of interest, which are just 7 different areas inside of the joint. And we're saying, okay, does this look normal or abnormal? So normal, abnormal, normal, abnormal. And we repeat that for all of the 7 different points that we're looking at. Here, this is a good example of what it looks like with increased vascularity. So this is what we call arthritis whenever we see that kind of synovitis. This is an example of cartilage damage. So the cartilage becomes soft and fluffy. Sometimes it forms these icicles that they send pain-producing molecules into the joint. And so we smooth those surfaces so that you can have improved function. This is what it looks like when a disc is displaced forward. And so you can see here all of those blood vessels. And so what that means is that every time you're functioning on the painful innervated portion that's actually behind the disc. This is what it looks like when there's a perforation, meaning a hole within the cartilage. And then we go to all of the 7 areas. And basically, the next step would be a synovial biopsy. And so using those small hand instruments. One thing that we do and we'll plan to do for your case will be platelet-rich plasma. So basically, when you're asleep, we draw your blood and then we spin it in a centrifuge. Gravity separates out all of the good components. And so you can think about it kind of like vitamins. They all go into one layer together, growth factors, and we inject that into your joints at the end of the procedure. Oh. In some cases, we put on orthodontic brackets to pull the jaw forward after surgery. That's not our plan here.
Okay. Yeah.
You could stop and us. Thank you.